believe I will start. Well, good morning, everyone. I'm Mayor Tom Barret, and I wanted to talk to you along with my Health Commissioner Jeanette Kowalik, because there's been a lot of events that have occurred over the last few days, and I think it's important for us to keep the lines of communication open as much as possible. Many probably have seen in the last half hour that Governor Evers has announced that he is going to issue a stay-at-home order. And I want to talk a little bit about that because we have prepared a stay-at-home order here in the city of Milwaukee as well. Commissioner Kowalik, working with our city attorney's office, working with local stakeholders, we have spent a lot of time developing a stay-at-home order this morning. We shared that order with the governor last night, had a conversation with him. It's been reviewed by his legal staff. It's fair to say that our order, and in many ways his order, are modeled after orders that we are seeing in other states. In particular, we looked at the state of Illinois' stay-at-home order because we thought that that offered a lot of guidance as to what we are trying to do. Let me begin by saying what the stay-at-home order is not. Excuse me. What the stay-at-home order is not is it is not an order telling you to basically shelter in place. And this is important because what we are trying to do here is we are trying to obviously create a safer community. Scare anyone, it is not to alarm anyone. And if this were a shelter in place order, it would mean that wherever you are, if you were in a TV station, if you were in a laundromat, if you were in a grocery store, that you should stay there. That is not the intent of what we are trying to do. The intent of what we are working toward is making sure that people are at home, that they are distanced from other people, and the reasons are pretty obvious. What we continue to see, unfortunately, is we continue to see the torrential push, if you will, of COVID-19 cases toward our community and now in our community. It seems like a million years ago, but it was only 2 weeks ago yesterday that Commissioner Kowalik, Congresswoman Moore, and I talked about the fact that we had no cases in the city of Milwaukee, and that went on for several days. Now we have over 200 cases in Milwaukee County. Approximately 75% of those are right in the city of Milwaukee. And that means that this is something that is obviously hit our community in a very, very major way. Many of these cases are located on the northern part of the city. And so I want to make sure that our residents, particularly on the northern part of the city, are listening to what I'm saying. Please, please, please do everything you can to keep your distance, literally, from other individuals. And if you look at the statistics, what you're going to see is you're going to see that people in their 20s, 30s, 40s are the ones that are the age groups that are having the highest prevalence of COVID-19 positive testing. That means they are the carriers. That means they are the ones, when they interact with older people or other people their age or even younger people, are the ones that are carrying it. So even though they may feel invincible, the fact of the matter is that this is a community-wide problem. So we have prepared a local stay-at-home order that the health commissioner will be executing today. And it tracks exactly what we're doing with the state. It tracks what's going on in states like Illinois. And so people will, and this is very important, this is not issued to cause a rush on the grocery stores. You can still go to the grocery stores. That's very, very important. We don't want to see all grocery store parking lots filled up because people feel this is their last chance to buy groceries. You'll still be able to go out and take walks. You'll still be able to go for a jog if you want to go for a jog. What we're trying to do is send the message, a very, very strong message, an exclamation point on what we have said before and what the governor is saying today about how serious this problem is. This is a life and death issue, and our order will go into effect before the governor's because we understand that this city and this county are the places where we're seeing the most cases in the state. So we've discussed this with the governor. We've had a long conversation with the governor and his staff last night. I think it's fair to say we are very much on the same page. And what we're trying to do is to have people stay calm, but we want them to understand the seriousness of this problem. So looking out several weeks, what are we concerned about? We are obviously, if you look at what has happened in Italy, if you look at what is happening right now in New York, we are concerned about the number of hospital beds, the number of ventilators, the number of respirators that will be available. And the more people that get sick right now, the more that is going to create an ethical dilemma as to who is going to be entitled to have a respirator or a ventilator. The best way for us to avoid that is to make sure that for those people in our community, if they're going to get it, that it's spread out over a long period of time. And so this is not just about you, it's about our entire community. It's about your mother, it's about your grandmother, it's about your neighbors, it's about people that you love in your life, to make sure that even if you feel strong, that you do not want to put them into harm's way. So I'm going to turn it over to the commissioner to talk a little bit about this. I can talk a little bit later about voting, the challenge that we have in voting. But again, I'm very, very pleased that the governor is acting. This is something that we have been pressing really since late last week, because we know how important this is. I view this as a life and death issue. And the more we can concentrate our efforts, our community efforts, into defeating this, the faster our normal lives can get back to order. And so I recognize that this creates a lot of hardship. I recognize that there are a lot of people who are hourly workers or temporary workers that are affected negatively. I recognize that this is putting mothers who have kids into very difficult situations when they're trying to deal with childcare. That is all incredibly, incredibly important. And the faster we take the steps that are necessary to get our lives back to normal, the faster we will be in a healthy situation, our economy can start to rebound, and we'll be able to get back to where we want to be. So with that, I'm going to turn it over to Commissioner Kowalik.
Good morning, everyone. Can we just have a moment of silence for those individuals that passed away due to COVID-19 in our city and our state? So this is the goal of public health. We're trying to protect lives. We're trying to prevent death. We're trying to prevent unnecessary just disruptions in our way of life due to illness. I was just notified that a third death has been reported in the city of Milwaukee. It is also an African-American male in his mid-50s, and the date of this death was the 20th of March. So again, this releasing an order is extremely important. It's a tool that I have as a health authority or health officer for the city of Milwaukee, and then as noted in the journal article about the emergency powers that are crossed over for the county, since there's no county health commissioner. So there has been a number of conversations with others, other health officers in Milwaukee County. There's 11 of us, as well as surrounding jurisdictions, as southeastern Wisconsin has the brunt of the cases right now. As of this morning, the county has 205 cases, and then the city of Milwaukee has 157 cases. So as you can see, our first case was on Friday the 13th, and we're already over 100 cases. So this is serious business. We want to make sure that everyone knows that staying at home, if at all possible, is the best way for us to prevent this disease at this point in time. I know that there have been a number of orders issued from the governor's office, including this new stay-at-home order that he will release details, I believe, at 1:30. So I understand some of the angst and confusion from the public, anxiety, but then there's people in our community that are moving along like there's nothing happening, that, you know, business as usual, nothing to worry about. I'm not, you know, concerned about my health because I'm not high risk or I'm not over the age of 60. And that's just not the right approach right now. As you can see, these cases are dramatically increasing. According to Dr. Weston, who is our medical director for the county and for emergency medical services, we're increasing at about 50 cases per day. And then we estimate that for every 50 cases that there is one death. So we have to do something. Looking at other jurisdictions, other countries, when we move into a stay-at-home order, it is one of the most effective ways to slow this down. Again, slowing this down also helps our healthcare system so that they're not overrun with a surge. Like you're seeing in New York City and Italy, they're really struggling right now because the capacity for being able to provide services to people that need hospital beds and ventilators and other specialized medical services are not available because there's so many people. So we want to flatten the curve. We keep saying that, plank the curve, flatten the curve, because slowing this down is going to be our path forward. So, moving forward with an order of this nature includes a number of items, such as exemptions for various businesses that are essential businesses, such as grocery stores, gas stations, healthcare providers, organizations and businesses that create supplies for the response for this event. So all of that will be outlined in an order. We understand that, again, we still need to make sure that our basic human needs are being met, and that this is not a lockdown, if you will. Again, this is not a lockdown. This is stressing that staying at home is the best way for us to prevent COVID-19 from increasing and causing more damage to our community. And another point that I want to highlight too is, what about vulnerable populations? So we have homeless population here in Milwaukee. We also have individuals that are not safe at home. Their conditions don't warrant safety. They may be in domestic or intimate partner violence situations. So we are working with our partners to identify safer options for people that don't have stable housing during this period of time. Again, we don't know how long this will be, but we want to make sure that at least there's options for people, that they're not being subject to unhealthy or unsafe conditions due to an order of this nature. And then lastly, I just want to shout out all of the service industry workers, healthcare workers, first responders, public health professionals, including Milwaukee Health Department and all of the other health departments in the area for working tirelessly on this COVID-19 response. There's a lot that goes into this that many don't see behind the scenes. Our lab has been operating like nobody's business. So I just want to acknowledge all of the hard work that's going into preventing the spread of COVID-19, but moving beyond that, getting to having an order where folks will need to stay at home to prevent the spread. That's where we're at right now. We don't want to wait until we have more cases and more deaths. We want to prevent as much as possible. Again, those individuals that are most at risk, over the age of 60, and individuals with underlying health conditions. 2 of those deaths were individuals in their 60s, and now we have this one in his 50s. And then we also understand that some of the cases right now, the city of Milwaukee, as the mayor noted, a number of the cases are in the north side. So the health department has created outreach that will go out to those communities, mainly the African American community, which is where we're seeing most of the cases right now in the city of Milwaukee, just to increase awareness of prevention, like hand hygiene and coughing in your sleeve and not touching your face. Again, I know it's very difficult when you say don't touch your face, not to touch your face, but please understand that there's very basic things we can do to prevent disease, and by executing them in our own practice and staying at home will be our best path forward. So that's all that I have for right now.
Más cerca.